Well, many public transportation companies are not requiring masks now, and it's the first time commuters and travelers have had the option in more than 2 years. This week, as we've been telling you, a federal judge voided the mandate, directly going against the CDC's proposed mask extension. Well, new today, 12 News reporter Brittany Schaefer spoke to a local doctor. She joins us live in studio with how medical professionals feel about the change. Brittany.
Well, Brian, the mask requirement was dropped on virtually all Rhode Island forms of public transportation, including RIPTA buses, Amtrak trains, the MBTA, major airlines, and in Ubers. Today, there was a good mix of people both wearing masks and going without, but one Lifespan doctor tells me it's too soon. Lifespan's director of epidemiology and infection prevention is concerned after the nation's health protection agency was overruled.
Overruled by an individual without a robust background in the epidemiology of respiratory viral pandemics.
The CDC recently extended the mask mandate on public transportation through May 3rd due to rising variant cases, but the decision was overturned by a federal judge. Dr. Leonard Mermel's advice for travelers is in line with the CDC.
I still would use respiratory protection and recommend it. At the present time,
Dr. Mermel says new variants are still forming with higher transmission rates leading to rising cases.
It continues to gain strength with regards to being transmitted more easily person to person. And then in the face of that, we're saying you can stop masking when you're sitting next to someone for minutes, hours, or longer.
Timothy McAfee is traveling back home to Maine by train. He says on his way to Rhode Island, masks were required, but today he's going without.
We came from Portland, Maine, and into Boston on a bus, and then we took the train from Boston to here. So we'd been in our masks for about 3.5 hours, and that's uncomfortable.
And while there seems to be an even split on most forms of Rhode Island public transportation, Dr. Mermel says not to let COVID fatigue get to you.
I get it, myself included. We're exhausted. But that exhaustion is not a reason to drop our guard.
And the Biden administration says they are reviewing the Florida judge's decision with a potential appeal still on the table. Coming up new at 5, the reaction from someone riding the train today with an autoimmune disorder and what Dr. Mermel tells me are more risky forms of public transportation. For now, live in studio, I'm Brittany Schaefer, 12 News.
Commuters are facing the pandemic age-old question to mask or not to mask. A federal judge overruled the CDC's mask extension, voiding the mandate. A Rhode Island doctor calls the move concerning. 12 News reporter Brittany Schaefer joins us live in studio with what that doctor is advising you to do to stay safe. Brittany?
Well, Shannon, Uber, most airlines, RIPTA buses, and trains are all now mask optional. But Lifespan's director of epidemiology and infection prevention says he is still recommending people wear masks while on public transportation, something the CDC is also advising. For the first leg of Timothy McAfee's travels, masks were required.
We'd been in our masks for about 3.5 hours, and that's uncomfortable.
But today for his return home, he's all smiles.
It's been so long. I feel safe.
Also boarding the train in Providence, Danica Wright.
I have an autoimmune disorder, so I'm high risk. So I'm going to continue to wear my mask.
The Providence college student wore a mask before the pandemic popularity and tells me she doesn't mind if others choose to go without. But Lifespan's director of epidemiology and infection prevention says trains and airplanes where windows are unable to open are a risk.
That HEPA filtration really isn't going to do much if someone's in close proximity. It's going to help if someone's far away, but not in close proximity.
The surprise mandate lift coming earlier this week after a federal judge voided the CDC's mask extension. Dr. Leonard Mermel says the decision should come from experts with a robust background in respiratory viral pandemics, not an individual. He tells me with more infectious variants on the horizon, now is not the time to drop your face guard.
It continues to gain strength with regards to being transmitted more easily person to person. And then in the face of that, we're saying you can stop masking when you're sitting next to someone for minutes, hours, or longer.
And the Biden administration revealed today they will likely appeal that federal judge's decision. The deciding factor, they say, will be based on the CDC's conclusion that the order remains necessary for public health. Live in studio, I'm Brittany Schaefer, 12 News.